Thank you, Travis. Good evening, viewers, and welcome to tonight's regional news. Kids ages 5 to 11 should get a booster dose of Pfizer's COVID-19 vaccine, advisors to the United States government said Thursday. The Center for Disease Control and Prevention quickly adopted the panel's recommendation, opening a third COVID-19 shot to healthy elementary-age kids, just like what is already recommended for everybody 12 and older. The hope is that an extra shot will shore up protection for kids ages 5 to 11 as infections once again are on the rise. Vaccination with a primary series among this age group has lagged behind other age groups, leaving them vulnerable to serious illness, says the CDC Director Dr. Rochelle Walensky in a statement. We know that these vaccines are safe and we must continue to increase the number of children who are protected, she said. Earlier this week, the Food and Drug Administration authorized Pfizer's kid-sized booster to be offered at least 5 months after the youngster's last shot. The CDC takes the next step of recommending who actually needs vaccines. Its advisors debated if all otherwise healthy 5 to 11-year-olds need an extra dose, especially since so many children were infected during the huge winter surge of the Omicron variant. But the U.S. now is averaging 100,000 new cases a day for the first time since February. And ultimately, the CDC's advisors pointed to growing evidence from older kids and adults that 2 primary vaccinations plus a booster are providing the best protection against the newest coronavirus variants. We tell you now that scientists who have monitored numerous outbreaks of monkeypox in Africa say they are baffled by the disease's recent spread in Europe and North America. Cases of smallpox-related disease have previously been seen only among people with links to Central and West Africa. But in the past week, Britain, Spain, Portugal, Italy, US, Sweden, and Canada all reported infections, mostly in young men who hadn't previously traveled to Africa. France, Germany, Belgium, and Australia confirmed their first cases of monkeypox on Friday. Monkeypox typically causes fever, chills, rash, and lesions on the face or genitals. The World Health Organization estimates the disease is fatal for up to 1 in 10 people, but smallpox vaccines are protective and some antiviral drugs are also being developed. One of the theories British health officials are exploring is whether the disease is being sexually transmitted. Health officials have asked doctors and nurses to be on alert for potential cases, but said the risk to the general population is low. Nigeria reports about 3,000 monkeypox cases a year, the World Health Organization said. Outbreaks are usually in rural areas where people have close contact with infected rats and squirrels. Now for a final story coming out of Venezuela. The United States government is moving to ease a few economic sanctions on Venezuela in a gesture meant to encourage resumed negotiations between the U.S.-backed opposition and the government of President Nicolas Maduro. The limited changes will allow Chevron Corp to negotiate its license with state-owned company Petróleos de Venezuela, but not to drill or export any petroleum of Venezuelan origin. 2 senior U.S. officials told the media. The officials spoke on the condition of anonymity because the formal announcement had not been made. The moves follow goodwill gestures by Maduro after meeting in March with representatives of the administration of President Joe Biden and a recent gathering in Central America between U.S. officials and the main unitary platform opposition coalition to discuss a path forward. That has brought us to the end of tonight's regional news. Thank you for watching. Back to you, Travis.